that you have joined us today. We've had just over 200 people that have registered. So we're about half that's been able to join us so far. So we have a very full audience. We're so pleased that we had so many people that were interested in this topic. And again, we hope that being able to provide this to you virtually makes access a little bit easier for some of you, especially if you live outside of the Oklahoma City metro area. My name is Deborah Anderson, and I'm the Executive Director for the Oklahoma Partnership for School Readiness. We are pleased to bring a conference to you that says a shared responsibility as part of the title. At the Oklahoma Partnership for School Readiness, we are focused on ensuring that we have connected organizations and programs and families. And our goal is really to ensure really strong coordination around the early childhood system. And this is a great example of two agencies that have responsibility for preventing and serving kids and families in the spectrum of child welfare services, and they have joined together to give you a great overview of the Child Abuse Prevention State Plan, and to talk a little bit about some of the more secondary prevention services that the Department of Human Services is going to be providing in a state plan. So I won't steal their thunder. They're going to share a lot more with you about that. All right, before we begin, I have just a couple of housekeeping things to talk about Zoom. Hopefully everybody's had pretty decent experience with participating in Zoom meetings, but just to remind you, there is a mute button on the bottom. For most of you, it'll be on the bottom left-hand corner of your screen. We are muting all phones. That helps us cut down with a little bit of background noise, because sometimes we forget to mute ourselves. So you will need to unmute yourself, although we predominantly are going to ask that if you have any questions during the presentation, that you will open the chat panel, and please put any questions in the chat. Again, because we have almost 200 people that we anticipate joining us today, we think we can best navigate the questions that way. I will be moderating the chat box along with some assistance from Sherry Trice and Keitha Wilson. If we're not able to get to all of your questions today, please know we are saving this chat, and that the programs will post additional answers if we don't have time to get to your questions. Then if you want, while we have so many people on the phone, sometimes your system might run a little bit better if you stop your video while people are presenting. It's also sometimes helpful up in the upper right-hand corner of your screen. There's like a square there, and you can change your view on whether you want to see multiple participants or just the speaker. So whatever your preference is, please go ahead and play around with that a little bit if that's better for you. So that's the rundown on chat. Again, we are predominantly wanting you to put your questions in the chat box. We have also posted some links in the chat box right now. We may need to do those a second time, Courtney, because I'm not quite sure if people can see them if they just joined us. So we'll have some additional information that we'll be sharing with you. So keep an eye on the chat box as we go through the meeting. All right. So at this moment in time, it is my pleasure to introduce to you Dr. Deb Shropshire. She is the Director of Child Welfare Services at the Oklahoma Department of Human Services. I think everybody in this audience certainly should be very familiar with Deb. She is visible, passionate. Child welfare is in such good hands with her leadership. I just wanted to reflect briefly in my introduction of her how grateful we have been through OPSR to work with Dr. Shropshire in her role as Director of Child Welfare. We've had a number of opportunities primarily during quarantine time, that we have done some joint presentations, and Dr. Shropshire and I also were part of a build conference where we got to brag on a national level what is occurring in Oklahoma in ensuring that we're coordinating our services so that young children in the child welfare system and families with young children at risk of entering the child welfare system have the special kind of attention that we need to ensure that families with young kids have. And so she's been a great partner, and there's so many good things I can say about her, but I'd like to introduce Deb Shropshire at this time, and she will provide a welcome for us. So, Deb.
Well, good morning, everyone. We are so pleased that you are willing to take this morning and join us. We know your time is valuable, and we have been working hard to try to make this time together that we have with you a really valuable experience, both to learn about or have a conversation about where our state is in terms of some of its prevention work, as well as really, I hope to sort of set the tone that we are interested as leaders and in this state in having a child and family well-being system, not just a child abuse prevention system or a child welfare system, but really that we are committed together to building and strengthening families, and for our children to be well and for our families to be well. And that's really what the conversation and the focus of the morning is. So welcome. Thank you for coming. We do have a very special guest with us. It's hard for me to figure out which title use because this man has so many titles, but Secretary Justin Brown is the secretary for the cabinet that includes Children's Services and Human Services. And he's also the director of the Department of Human Services. He's my boss and he's a friend, and he is incredibly passionate about the work that those of us on this call are doing. And so we are really, really pleased to have you with us, sir, and have some time with you, and just looking forward to hearing from you as we kind of kick this meeting off.
Well, thank you, Deb, for that introduction. And by the way, thank you for letting me go before you really get into the meat of your work, because I generally, for those of you on the phone, when Deb and I speak together, I just sort of get in her way because she is so passionate and qualified, and her vision is so strong that, like I said, I just sort of get in the way. So I'm glad to be able to kick us off today and turn it over to the true champions here on the phone. I'm honored, honestly, to be on the call with you all, such a sort of broad array of passionate advocates for our kids and families and our communities, and appreciative of the time to jump in for just a couple of minutes here early on. Really, I wrote down a number of quick thoughts. Candidly, the title of the day had a couple of elements that really resonated with me. The first is shared responsibility. That's the first one I wrote down. And honestly, we all do have this obligation to, or what I feel is an obligation, to work together. And honestly, it's more than an obligation. It's a full-blown opportunity. When you look at the space we're in today, what's happening in the world, we have a real opportunity to take this sort of shaken world and move forward in this new design that we are all building collectively. So I'm thankful to be on the call, not just with my teammates with the Department of Human Services, but also with the State Health Department, who's been a wonderful partner of ours over the last roughly year and a half, and I know will continue to be that going forward. Our agencies are building deep relationships with one another, and I really am looking forward to the opportunity to continue to build a relationship, not only with them, but all of you all on the phone. We have to do this together. It is a shared responsibility and shared opportunity. The second thing I wrote down was building healthy communities, and Deb mentioned it there just for a second, that really the approach that she has taken, I cannot stake any claim to this at all. It's Dr. Shropshire's vision, as far as I know, is really transforming the way we think about this from a child abuse prevention system or a child welfare system to a family strengthening system and a family resiliency system. And so it's really her vision and not mine, so I'm not claiming it, but I'm saying that really resonated with me. because that is the opportunity we have going forward. So if I can ask for the slide deck to start real quick here. I do have a few slides to share. The next one is great, please. Thank you. And you can do the whole thing in one. That's great. So really what I wanted to share, and some of you have probably heard some of this before because I use these words a lot. Early in coming to the Department of Human Services, we all sat down as division leaders, as the agency leaders, and talked about this concept called finding our true north. And the reason I talk about it so much is because it truly is a framework for everything that we're doing. And so it's my opinion that as you build structure and build organization, you have to tie it to a series of philosophies and that really then result in significant long-term strategies moving forward on those things that you think are important. So we built this True North concept. Each division within the agency, of which we have 6 divisions, one of which is child welfare, came up with their own True North. It took 90 to 120 days. Dr. Shropshire was incredibly intentional in working through that. And honestly, it evolves slightly here and there. Every once in a while, I may get another slide from her with a different word changed because what we do know is this system does have to evolve over time, and it can't be static. So anyways, the intent of this True North really is to provide motivation to the team. It's to empower a workforce of 6,300 employees to make decisions, to move forward. They know that they can make a decision, they can build a strategy and a plan as long as they sort of stay in these guide rails of the things that we've said are important to us and that we've all come up with together. It, of course, provides direction in times of resource and budget scarcity, and that will continue to come our way. We know from COVID that there have been dramatic economic impacts, which, of course, result in dramatic potential social impacts. And so we've got to move forward in a certain direction in times of resource and budget scarcity. And then lastly is this opportunity to be transparent. Our agency has in many ways been sort of seen as a black box over the decades and generations, and you can't really access it, and it's this mystery. And our intent really is to tear down the walls, and I think you'll see some of that here as we move forward. So next slide, please. What you'll see here is as the divisions, and you can go all the way through all of these, that's fine, or through these first 4. What you'll see here is, or what you may or may not know, is all of the divisions created their own 3 to 5 True North strategies. Those are online. The website's on the bottom, our OKDHS.org. I'm not going to go into those. But what I do want to do is highlight, in the context of sort of this prevention / family building and community strengthening conversation, highlight a few of these. I'm going to just run through real quick all 8 of the executive leadership True North. So these are the strategies for the whole agency, not division by division, but for the entire agency to be supportive of the divisional work and transformation in our communities. So the first 4 are here. There are 8 total. The first is and again, some of these I'm going to go a little deeper into, and I'm going to tell you exactly what we're doing, what we have done, and what the philosophy is and where we're going to move going forward so that you can hopefully engage in partnership with us in some of these places. It's not for us to do this work alone, as we've said, it's for us all to do it together. So the first is becoming a hope-centered organization. The second is removing systemic barriers that keep our families from being successful. I'm going to dig into both of those here in a minute. The third is becoming an elite employer. Huge definition there, lots of work going on. The fourth is becoming a model of efficiency, effectiveness, and transparency. Move to the next slide, please. And you can go all through 5 through 8. The fifth is innovation, is becoming, okay, in the context of child welfare, this is interesting. I don't typically say this. Here, it's becoming a national thought leader and program innovator. And that is very true. And we are definitely moving in that direction in lots of different spaces. But in the context of child welfare, specifically around the idea that we've been in this lawsuit that you all probably all know about called the Pinnacle Plan, it's really becoming a self-correcting organization. That's really an innovative strategy here, that when there's a problem, when there's a system that doesn't work right, there are maybe people in certain places that don't live up to the goals of the organization, that we have a way of correcting it ourselves. And we don't need to solicit outside influence or to correct our own problems. So it involves really building deep feedback loops and, candidly, a safe place to raise your hand, whether you are inside the agency or you are a customer of ours. And that's critical. Like if this place has to be an organization that allows somebody that we are currently serving. And that could be a biological parent. That could be somebody who's receiving social safety net benefits to raise their hand and say, this isn't working for me. And we have a mechanism to change the organization. So we're working deeply on that. We can talk about that at another time. I'm teasing you all for the next time we're together. I'll hit on some of these other ones. The number 6 is really reintroducing ourselves to the state. What we see as we talk about the resources that we can provide as an agency to our families, we see that a lot of families just refuse to take advantage of them because of the 3 letters that come to your door, DHS. And that means we have to change the narrative. My view of the agency 15 months ago, before I came, now almost 18 months ago, was really driven by what I saw in the evening news. And the truth is just so different. For every bad story you hear, 1,000 incredible things are happening behind the scenes, and we have stunk at telling those stories. And the result of that is that we just people just don't take advantage of the resources that we can provide in the form of in this context, family strengthening and community building. So that's number 6. Number 7 is building a culture of equity, diversity, and inclusion. I believe we have an incredible opportunity here. We serve historically about 1.2, 1.3 million people a year. This year, unfortunately, will be more than that. The pandemic has resulted in a mass sort of influx of need, specifically to our social safety net services. So we serve, potentially 1.5 million people, a third of the state's population. And we are the 8th largest employer in the state, regardless of state government or not. The largest employer in the state, so in state government, 8th largest overall. And so that means we just have tremendous influence. And this is a place where we can really make change for those that we serve. And I'll talk a little bit about that here in a minute. And then the last, which is really the sort of the conversation we're having today, and the one that I can talk the most about, is moving to a space of prevention, moving upstream to solve problems for families before they become in crisis. So if you'll move to the next one, please. What I'm going to do is I'm going to go through, and you can hit all those bullet points on this first slide. Thank you. What I'm going to do is highlight a few of these that may be particularly relevant to this conversation. And I'll admit to you, my thought here was I'm going to talk about this sort of prevention or family strengthening concept as we walk through, but I haven't fully planned this out ahead of time. So we're going to work on it together. The first one, if you all on this phone have probably seen resilience, a dozen times, but the concept of adverse childhood experiences makes complete sense to me. And every time I see it, I think, man, that totally resonates, that we are all just a product of the experiences that we've had. But I'm always also left wanting more. And what do I do with that understanding? And for us, we believe that the science of hope and Dr. Hellman and Casey Gwynn's work, and the thousands of research studies that are connected with that, that is the answer for us, that higher ACE scores can be combated by rising hope scores. And so we're doing deep work here. We are formally under contract with Dr. Hellman to sit in our programs to understand where we build, where we provide goal setting opportunities, where we build pathways. In many cases, our agency is a pathway itself, and the services and the workforce that we provide. And then how we also build willpower and agency to help get people to that future that they know is better than today, and that they can do something about it. We've measured hope for the first time in our agency. We are measuring now in our customers, building technology that allows for us to do ongoing organic measurements as we provide interventions, so that we can lean into interventions and providers that build the most hope in the most people and spread that statewide. We're working with the First Lady. I'm sure all of you have seen her dozens of times talking about trauma and the science of hope. And she is a true passionate advocate for this work. And we are honored to be sort of at her side, helping to facilitate. We're working on a Hope Summit right now, potentially here in the spring or the summer. Just depends on how COVID works. We really would like to do this in person. And so I think we're going to delay until we can do that in person. And using consistent language across the board. But lots of work and hope across the agency. So next slide, please. Number 2 is removing systemic barriers to keep our customers from being successful. Those barriers are everywhere. You all see them: transportation barriers, childcare barriers, technology barriers, all over the place. And we believe that removing those barriers provides smoother transitions and smoother pathways to success. And to me, that is an ingredient of resilience and stronger families, is understanding that future is better, and that pathways, and that there is a path for me and my family to get to that position. One of those ways, the one that I talk about the most, is this concept of embedded workers. We have lots of different programs working on this sort of space right now, but ultimately, because our agency is in many ways a pathway to success for those that we serve, we can't be tethered to the offices that we have. We have today 92 buildings. Our service first model that you may have heard about is reducing the physical footprint by half to a third in the number of buildings that we operate. However, leaving a building actually means we're going deeper into our communities because of this sort of embedded worker service first model, where we're replacing a building in a county office with dozens of physical touch points that we can meet our customers and serve them directly. And that is super exciting. That's one way. Embedded workers, we're starting to layer them everywhere. School-based social services is one component of that. We're building social work teams in police departments. We've got social workers at Homeless Alliance, and lots of embedded workers where our customer is where we want to be, so that we can serve you right there where you are. I'm going to flip through a couple of these, but the bottom one here is the Community Hope Center model. And we've received a little bit of attention recently on this strategy, but really was in response to some fear that we potentially had of kids not being seen by our teachers. And we built a full strategy because, honestly, as systems are removed, economic systems, education systems, transportation systems, families are falling through the cracks. And those were removed because of COVID. I mean, those are shutdowns and quarantines and all those sorts of things. And so our resources that are typically provided to kids and families in schools now have to be provided in different places. So we've built this Community Hope Center platform. I'm not going to go too deep into it, but our federal partners believe it to be a revolutionary platform that no one is doing. They were here 2 days ago announcing significant funding flexibility for some of our block grants that allow us to lean into and continue to invest in the program after the initial CARES Act money is gone. So we have 36 Hope Centers already stood up as of today, serving over 2,000 kids, I believe is the number right now, and their families, because we have embedded workers in each of those Hope Centers, so that we can not only provide children, activities, social and emotional well-being, and all of those resources to those kids, but we can also serve their families, strengthening their families, their bonds. But then if there's a employment issue because of the pandemic or whatever, we can help to get them workforce development opportunities and really provide resources to families. All of these things, to me, contribute to healthier families, more resilient communities that in the long term are doing this thing called prevention. So next slide, please. I believe we're on number 6. Yeah, there we go. So I talked a little bit about this in the initial rundown, so I won't go too deep here, but ultimately we have got to share our story in a different way. Those 1,000 stories that happen for every one bad story that you see on the news, we do not celebrate like we should. We don't celebrate our partners like we should. We don't celebrate our workforce like we should. We don't celebrate the incredible achievements of the people that we serve, our customers, like we should. And so we are absolutely going to do better and are doing better right now. Keely McEwen is our Chief of Strategic Engagement, and she's building a full platform for ongoing communications. We talked a second about this customer feedback loop, really listening to the voice of those that we serve. We are bringing in a fellow through Foster America to build a constituent engagement platform. So we have a real opportunity to change the narrative of the Oklahoma Department of Human Services, and the result will be resources flooding to the people that we serve, as now they're engaging with our agency without that fear and stigma that traditionally has come with those three letters. Next slide, please. Building, again, I talked about this some, and we're still sort of formalizing all of this, but really the way that building this culture of equity, diversity, and inclusion, the direction we're heading. And I know there's some DHS employees on the line here. A week from today, we're going to do a full Teams live, and I'm going to lay out the entire plan and strategy and all the work that we're doing on this particular, really just this slide. So I'll preview it now. Just don't, if you're with DHS, don't tell anybody else that you work with. Right now, so the concept is, I sort of work visually, and so I'm building the concept around this sort of three-legged stool of an equitable organization. And the top of the stool is truly being an equitable organization. What does that mean? What are the measures? How do you prove that you are that you value equity and diversity and inclusion within your organization? And then each of those three legs, there are sort of three different approaches. The first is learning and training. And it's building real resources to equip 6,300 employees with the understanding of systemic bias and racism, why the system is the way that it is, so that we can see where we've come from. Because if you don't know where you've come from, you can't change and you can't know where you're going. So that first leg is training and learning for our workforce and potentially our partners. We're building this so that as we build our partners or ourselves, we can also help our partners who are interested in going alongside of us with this work. The second stool is listening. There are three components to the listening stool, and I know I'm probably getting well beyond my time here, so I apologize. But the first component is listening to leaders in our communities. We've built what's called a Council of Voices. I started this work in October, probably, of 2019. And this council is 20 to 30 people who represent many, it can't be all, but many underrepresented communities. So of course, communities of all different racial and ethnic backgrounds and makeups, but other representatives of the aging population. So seniors are represented, those with disabilities are represented, really all of these communities that our systems, these massive systems, were intended to help, but were never built informed by those communities. So this Council of Voices, I meet monthly, 2 hours at a time, and it's an opportunity for us to talk about the things that we're doing and ask what we're missing. How is their community under or unrepresented in the development of this brand new strategy? All of these things we're talking about today, most of them I've already run by the Council of Voices to get their feedback on. And it's also an opportunity for them to come to me and say, this is how my community is not represented in the work that you're doing today. And so that allows us to listen to the community and leadership. The second is an internal council on equity that we're developing through deep listening sessions. We have an outside provider that comes in, facilitates 20 to 30 people at a time, and listens to them talk about the places where they have seen inequities in our system, where they have seen sometimes overt racism over the years in their work, and it's our workforce themselves. We are overrepresented by our Black community in our workforce, which is fantastic, but we don't listen to them, and we never have, and now we are. And so the listening sessions that we're doing are now transforming into action sessions, what we're going to do as a team with that workforce to change the culture. The third element is escaping me because I'm still building it. I'm just really going off the top of my head here. The third leg, is transformation. Yeah, so I sort of alluded to it in the last one, but you train people to understand, you listen to them, and now we all work together to change the systems to be systems of equity. So that's what we're building. The last one, please, is my last slide. So I'll give that preview to the next speaker. So that not the last. Yeah, that one right there, number 8. So we talk a lot in this conversation is really about the concept of prevention and moving upstream. For us, the opportunity really is that, we get, last year we had, I think 81,000 calls of abuse and neglect to the hotline. And what's really important to know is 90%, you all probably know this, but 90% of those calls are neglect, not abuse, and 70% of those are related to poverty. That's validated by our team in the field, walking into doors in Child Protective Services and seeing that this is a poverty issue for the most part. Now, we do deal with humanity, and there are certainly terrible situations that are well outside of the influence and impact of poverty. But poverty is a common theme. And if we can address poverty, I do believe that we can provide resources so that families can become stronger and communities can be more resilient. So we're working on poverty in 3 areas: social poverty, resource poverty, and economic poverty. Wonderful luxury that, of course, we have the symptom to the problem, and those, 63% of 81,000 calls a year in the same agency that houses the potential solution, which is Adult and Family Services, the social safety net. So we are a $3 billion, this year will probably be close to $3 billion organization. And a large majority of that is in the social safety net and in resources that we provide to our families to impact poverty. So we're building a poverty plan, trying to make that impact measurable and to sort of prove the strategy going forward. So with that, I'm going to take a breath. I'm going to say thank you very much for the opportunity to be with you all today. Thank you for your partnership. All of this work cannot be done in the walls of any one organization or with any one person. It has to be all of us together. And I would love for, at some point, any feedback, any thoughts. Feel free to email me, reach out if we see one another, whatever. Like, hey, I heard you all are working on this. Our website, OKDHS.org, has a button that allows you to raise your hand and submit thoughts or questions or ideas. And so we're trying to sort of include the community in the conversation as well. So with that, I will end. I say thank you and turn it back over.
Thank you so much, Secretary Brown. That was great. I think that really framed the rest of our conversation today. I don't see any questions in the chat box at this moment, but if any of you do have any questions that you'd like to ask of Secretary Brown, feel free to add those. We can get those to him at a later time. I'm not sure if you'll be able to stay with us for the whole morning. I hope you can. But
I actually cannot. Unfortunately, we have a Teams live with the whole team here in about an hour. So they get to hear me talk some more.
Gotcha. Well, we so appreciate your time today.
Thank you.
It's been fantastic to be on the Zoom with so many of us as we've continued to think about how to do our work together. And we do appreciate your leadership, and we appreciate the direction of the Department of Human Services. You all do play such a critical role in supporting kids and families in the state. And we're all proud to be stronger partners with you all in the future. And speaking of partnerships, it is now my pleasure to introduce Beth Martin. Beth, I have known for, our children are approaching 30, so I know it's been longer than that. And Beth and I have worked closely together through the Child Guidance program. Beth is the director of Child Guidance, and she's also the director of the Family Support Prevention Services. So her scope has expanded to include the home-based family services that provide parenting supports and prevention. Child Guidance also serves in that role, frequently more in a center base. So it was great that the Department of Health chose to put everything under one director and really work on how we coordinate all parenting programs at the health department. So at this point, I'm going to turn it over to Beth, and she's going to give us some additional remarks and set up the health department presentation.
Thank you, Deborah. I think I'm unmuted.
You are.
Great. Good morning. And I want to give special thanks to Secretary Brown for his welcome to this event and his vision for the future. As you may know, under the current cabinet structure, the Office of Child Abuse Prevention resides with Secretary Brown, while the remainder of the Health Department falls under Secretary Corbett. This structure has allowed for a deeper collaboration between OCAP and DHS. I think we're just scratching the surface of the possibilities, which is really exciting. I want to thank the Oklahoma Partnership for School Readiness, Deborah Anderson and her team, for agreeing to moderate this event. In the current climate, OPSR has had the opportunity to hone their Zoom moderating skills, and we appreciate their coordination and collaboration. I especially want to thank Keitha Wilson from DHS, who reached out to us with the idea of coordinating our state plan for prevention update meeting with the Family First planning. What genius. And at last, but not least, Sherry Trice, who is the community-based child abuse prevention grant coordinator for Family Support and Prevention Service here at OSDH. And Sherry's done a marvelous job of coordinating all the moving pieces for this meeting. I really think this will give everyone an idea of how prevention works, from primary prevention activities to secondary prevention activities to tertiary prevention, and what agency is primarily responsible for each part. But more than that, how we can support each other to achieve better outcomes for our children. I just have to say that I've always been a kind of glasses half full person. I have even found some truly positive things surrounding this pandemic, not the illness, but how we've adapted to change. I never thought I could work from home and be productive. I'm amazed by the technology we have to support us and how fast the state pivoted to make it happen. As you know, nothing moves fast in state government. I think we're being pushed and prodded to move beyond our "this is the way we've always done it" attitude, to consider ideas that we never would have given the time of day before. In developing the state plan for the prevention of child abuse and neglect, we sought your input from the beginning. Again, OPSR assisted us with community cafes to gather information from professional stakeholders, as well as families and communities. We also surveyed these groups to get a broader perspective, and we committed to meeting with you, our partners, twice a year to update you on the plan. Our meetings have been scheduled in April and October. The April meeting coincides with Child Abuse Prevention Month. This is an opportunity to raise awareness and get input about what new and different things we need to think about regarding the prevention of child abuse and neglect. The October meeting, this meeting, gives us an opportunity to update you on the most recent surveys and what our data is showing us. This morning, you'll have the opportunity to hear from the Family Support and Prevention Service epidemiology staff regarding some of the survey results. If you're interested in past surveys, a complete report of year 1 and year 2 data can be found on our website. It will probably be a couple of months before all of the 2020 survey data is posted, but we will give you a preview today. You will also have the opportunity to hear about Oklahoma's Family Resource Center network, what that entails, and how communities can participate. The Family Resource Center project is exciting to me because it begins in the community and responds to what the community needs. As you all have heard me say before, my philosophy of primary prevention is that we're all responsible for being that one person in a child's life outside of their family that can make a difference. Primary prevention is about establishing relationships, educating, modeling. Primary prevention activities are good for all families. Well, I have to admit that I'm a bit scared in the current climate. Our ability to reach out to that family in the grocery store or at the department store or at the park or at a worship service has been very limited. It's not like we can accidentally run into someone online, observe their behavior, and offer support and encouragement. Or can we? That's the challenge that is set before us. Everyone who cares about children, parenting, and relationships is being called outside their box. We're being called to explore ways of connecting with families that we have not thought of before. And we don't have to do it alone. All this connectivity has opened up huge doors for us. Look out there and see how other people are creatively solving their problems. Let me give you a couple of examples of what I've learned. First, you don't have to come up with a new idea. Support somebody else's idea. At the health department in my service area, we pretty quickly ran into a brick wall with home visiting. Can't do that with COVID-19. Our contacts with C1 families, our Children First families, were dropping off, and the only way we had to make contact were phones. Many families didn't have cell phones, internet, or computer access, and this was happening across the country. The Nurse Family Partnership National Service Office came up with a solution. They collaborated with Verizon to provide cell phones to NFP families who didn't have them. They prepaid for the service for 4 months, and that has since been extended. And they worked with us to distribute those phones to families in Oklahoma. We've been able to maintain contact with these families, at least in a limited way. This was possible because we supported somebody else's idea. The second thing I've learned is let somebody else support your idea. The Child Guidance Program has been working on the concept of initiating a parent line similar to the Child Care Warm Line, only for parents. This would offer basic parenting support to families and referral sources and services to professionals in their community. We were exploring the possibility with limited resources and staff. In the meantime, as part of the Children's State Advisory Work Group, I was assigned to the Prevention Subcommittee. In discussing ideas on prevention, I mentioned this project that Child Guidance has been working on. One member said, I have funds we can use towards the prevention message branding campaign. And another member said, I can support a position for the parent line. With a little collaboration, this project's on the fast track. Of course, there's several details to work out, but I'm positive that the project will be a great success because we let someone else support the idea. I'm sure you all have had similar experiences, and we have reached new heights in communication and connection. I want to thank each of you for all you do for Oklahoma's children, and I look forward to continuing our work together. Now I want to introduce to you 2 members of the Family Support and Prevention Service evaluation staff. Amy Dietering and Anira Sadiq are epidemiologists with my service area. Amy is going to provide some preliminary results from the community surveys, and Anira is going to provide some preliminary results from our stakeholder surveys. After they present, Lachey English will provide information regarding family resource centers and how that is supporting the Oklahoma Hope Center project. So now I will turn this over to Amy Dietering.
Hi, everyone. Can you all hear me? Did I unmute? Hello?
Yes, we're good, Amy. Thanks.
Okay. All right. Thank you. Okay. So I'm Amy Dietering, and I'm a program evaluator with the Family Support and Prevention Service at the State Health Department. And as Beth said, CBCAP created a 5-year state plan for the prevention of child abuse and neglect. And for this plan, data was collected through surveys with target audiences being parents for one survey, and then professionals working with families with children for the other survey. And we have administered these surveys annually in order to compare data from year to year. These are preliminary results from the 2020 surveys, and I'll present on the community survey, which is the survey that parents completed, and Anira will present on the stakeholder survey, which was completed by the professional staff working with families and children. Next slide, please. So we began sharing our survey links on July 31st, and then we closed our surveys on September 11th. For the community survey, we received 1,902 replies, and of these, 1,230 surveys were viable for analysis. Reasons for rejecting surveys were sometimes people would click into the survey, and once they were there, they would decide that they didn't want to complete it and then just click out. And then also surveys that only had 1 or 2 questions answered were also rejected. Next slide, please. Okay, so these surveys are very long, so not all results will be presented today, but we will provide at a later date a report that will include all the results. So related to the demographics, the majority of the survey respondents were white, female, and married. For the age of the survey respondents, the majority were between 30 and 49 years of age. And then related to the age of the respondents' children, most had children that were between 6 and 13 years old and then greater than 18 years old. Next slide, please. Okay, the survey had a question that was asking the respondents if they were aware of or had used different types of services or programs that are for parents. And these were the significant results. The home-based services had 70% of the respondents that were aware of the service, with around 20% that had used them, and about 50% that were aware but had not used. And the home-based services included programs such as Sooner Start, Children First, Parents as Teacher, and Safe Care. And then the parent support programs, which included things such as, right there, such as the Child Guidance Clinic services, parenting classes such as Incredible Years, Circle of Security, Circle of Parents, and Positive Solutions, and then also parent-child bonding instruction such as infant massage. Those programs had about 2/3 of the respondents that had not heard of the services. So this was the highest percentage of all the items that were included in this question. So that shows that we have some work that we need to do related to parent support programs and getting the word out. Okay, next slide, please. This question related to respondents. It asked them to describe their experience accessing types of services and programs used by parents. Prenatal health care had the highest percentage of people responding easy or very easy. And then services that are appropriate for your culture and language had the next highest percentage of respondents choosing easy or very easy. Okay, next slide, please. And then quality child care and services for the child's social, emotional development, and behavioral health were the 2 items with the greatest percent responding difficult or very difficult. Next slide, please. Next, the survey asked respondents to rate their knowledge on where to locate different services used by parents, and where to find food when having difficulty providing for the family, and where to find more information about their child's development were the 2 items with the highest percent of respondents choosing agree or strongly agree, so that they knew where to find those services. Next slide, please. And then locating services when having trouble with housing and where to locate home-based services for the family were 2 items that had the highest percentage of respondents choosing disagree or strongly disagree. Next slide, please. The survey also included questions about child abuse and neglect. So about half of the respondents had made a report regarding suspected child abuse or neglect. Almost 75% were familiar with Oklahoma's child abuse and neglect reporting laws, and about 12% were concerned at the time they completed the survey about a child being abused or neglected. Next slide. Okay. The survey also included questions related to COVID-19 and social distancing. Survey respondents were asked about positive togetherness related to 14 activities, spending leisure time together and engaging in conversation and getting involved in children's education were 3 activities that the option of more than before was most often chosen. And for some reason, one of my items didn't get included, but okay, next slide, please. Next slide. Okay, and then going on errands together. Okay, I'm sorry. Okay, we'll just skip to that. The survey also included a question related to conflicts in the household compared to before COVID-19 and social distancing. So decisions on going out on errands, appointments, or visits, and decisions regarding visitors to the home were the 2 items with the highest percent choosing more than before. There were no items that had less than before chosen most often. The majority of them actually had the same as before chosen most often. So next slide, please.
Amy, do you want to go back to the one before?
Let's see. Yes, if we could, please.
Oh, give me a second.
Yes.
Okay.
These were the items that were less than before. Actually, the engaging in conversation somehow got onto the wrong slide. It should have been on the one before. So yeah, going on errands together was the only activity that had the highest percentage responding less than before. And then all the other items in the list had the same as before, being the most chosen option. So, okay. Any questions? I guess you can post in the chat if you have any.
Yeah, and I don't see any specific questions related to this. We have had a couple of other questions that were related to some prior comments with Secretary Brown, and I think we're addressing those.
Okay.
You want to move on?
Okay, yes. Thank you for your time, and we can move on to Anira's presentation. Thank you.
Hey, hello everyone. Thank you for joining in today. Can you hear me?
Yes, thank you.
Okay. All right, so a little bit about myself. I'm Anira, and I'm epidemiologist with Family Support and Prevention Services. Thank you, Amy, for covering up the community version of the survey. And I would be talking a little updates of this works with family and children. Next slide, please. So our survey was launched July 31st of this year, and after a window of about 4 to 5 weeks, it was closed at September 11th this year. There were a total of 34 questions in the professionals version of the survey. Next slide, please. So some general updates here. Stakeholders survey with our team's efforts was able to reach out to 386 professionals across the state of Oklahoma. Professionals, so like Amy mentioned, we delivered the survey out like a link that could be accessed through cell phones, through computers, or any other form of gadgets, could be emailed. And the receiver would just click the link and then go from there. So about 16% professionals, they accessed the link, but they chose not to respond to the questions. So however, 84%, that is 324 professionals who did enter their responses to the survey. Among those who completed the survey, 76% completed the entire survey and 24% completed it partially. Next, please. So that's a general overview of where our professionals worked. So the type of organization on the left in the pie chart, it shows 44% of professionals who work with children and family. They are in nonprofit organizations. 42% work with some form of government organizations, while 13% and another 1%, they're other, which include faith-based groups, school-based, university-based, those kind of settings. On the right, in form of a bar graph, we have the level of education of our professionals. So most of them had a master's degree, that is 44%. And then the smaller than that is 34% professionals had some college degree. Others, like 7%, had doctoral degree, whereas 8% had some college, 2% had high school, were high school graduates. Next slide, please. So this would start just highlights of some of the questions, some of the 34 questions that were asked in the survey. Like we mentioned, more details would be coming up later this year. But for this question, they were asked, like, what did they think their families or they know of the use of home-based services like Sooner Start, Parent Pro programs, Children First, Parents as Teacher, and Safe Care, etc. So 73% professionals responded that they have referred clients to this service. 24% responded that they know of the service, but they have not referred clients to this, whereas 3% had not heard of those services. Next, please. When asked about the use of child care resource programs like DHS, child care licensing, local resource and referral agencies, etc., 68% responded that they have referred clients to these services. 28% responded they know, but they have not referred, and 4% responded they have not heard of this. Next, please. And when this one, I really like this question and the responses in terms of we get to know a lot. When asked about what the professionals thought the barriers to the client's use of available services and resources. So a lot of professionals thought that, like 77% thought that they do not know what's available. And then if you go down in terms of the frequency wise, and 51% responded that there's a conflict of work schedule of families, and then 44% had transportation issues, 41% had lack of providers in the community, 30% had language or cultural incompatibility with the provider. Other causes were location, wait list, and cost. Next, please. So these are two different questions. On the left, they were asked if they have any current concerns of a child or their client being abused. 92% did not have concerns of a child being abused. 8% had it. Another question, they were asked if they had ever reported a child abuse. 81% responded yes to this, and 19% did not, said no to this question. Next, please. So we wanted to cover the time during the pandemic, and then we did ask if there were the professionals were what type of mode they were using for their visits, and 77% were using virtual visits during COVID. We wanted to know what kind of challenges they had. So those challenges were related to the families they were serving and challenges related to themselves or their service. So in the top, we are covering the families, the challenges related to families. So in terms of what providers' thoughts were about for the family's comfort with virtual visit, they thought they were, most of them thought there were minor issues about families' comfort, and then about family software for virtual meetings. Then 40% thought their families had major issues for families' hardware like computers and other gadgets. 46% thought families had major issues. And similarly, 46% responded regarding families' problems, major problems with internet. In terms of providers' comforts with virtual visit, 56% thought they had no challenges. Provider software, providers have hardware and other internet. So most of them had no challenges to these as they responded to the questions. Next slide, please. So we also wanted to cover what professionals were thinking or they were seeing as their family's challenges pre-COVID compared to the during COVID time. So regarding alcohol, tobacco, and drug use issues in the families they served, so 62% thought they were they were a little more or a lot more than before. In terms of finances, 77% responded their family has had more issues, or regarding work or employment, 68% responded more issues with their families. Regarding children's schoolwork, 79% responded more issues. Regarding parenting or childcare, there were 71% responded more than before. So we can see almost in all of these categories, we had more categories, we'll publish them later, but then these had more issues than before COVID. Next slide, please. So some positive aspects before versus during COVID, we asked about professionals understanding regarding what's going on with their families, like in terms of showing affection. 47% thought they were same as before, but 43% did think they were more than before. Helping each other, 61% responded they were more than before. Helping each other more, solving problems together was more than before, involved in children's education was more than before, and spending leisure time together is also more than before COVID time. Next slide, please. So that's all from my summary from some of the questions. Any questions and comments? Thank you.
Thank you. I just sent a reminder out for folks to put any questions that they have in the chat box. So we'll pause a moment. We're good on time, so I want to give people an opportunity to ask any questions. While we're waiting, I'll take the liberty of reflecting. We collected stories from close to 500 families and providers this past summer as well. So the time frame of getting some responses, both of what you all were collecting and what we collected, were somewhat similar. And I just was reflecting in the presentations that we saw similar comments about challenges that families were having. So both of our work really align well with each other with the information we're working on getting our report out too. So that was validating. I mean, that almost doubles our samples, or more than doubles our sample size. And, I think really says a lot to what we're learning and hearing from families across the state. We do have a question. What will be done with the data from the surveys?
I'll take that one. The survey data is compared year to year, so we can see, and I expect to be some pretty significant changes or comparisons between years 1 and 2 and this survey. But we will use that information to inform program ideas. As you all may or may not know, our community-based child abuse prevention grant funds some activities that are done statewide. And so our hope is to utilize those funds to help develop community networks. And so the information that we gather from the data that we collect gives us an idea and informs us on what types of services may need to be funded or have things directed towards it. I will say also, while I'm on, is that the CBCAP grant did get an increase this year. Some of that is from a legislative increase. It's also That particular grant is based on leverage information that we provide. So some of it was due to that, but the majority of it was due to an increase in legislation. There is currently a bill in the House that's moved to the Senate that would give an additional increase, but we don't know anything about that one right now. I think it's held up in politics. So, but the information will be used to fund projects.
Great, thank you, Beth. We also have a comment just how helpful the information about technology is to really understand where we have barriers. And so anyway, just I think a nice comment about thanks for that, for surveying and sharing that information. So we have another question. It seems like a lot of families had concrete support needs. Will funds be used for these needs?
That, yes, the short answer to that is yes. Currently in our home visiting services, at least for the services that OSDH is supporting, so the home visiting programs, we have two different methods of providing services. We have contracts through the Office of Child Abuse Prevention for our parents as teachers contracts. And so funding that they receive from the state can be used towards that. There may be additional funding to assist with concrete needs. The other piece is the Children First home visiting that is provided through the state health department. Yes, the CBCAP funds can be used and directed towards some of the concrete supports for those services. We also have the blend of our McVie funded home visiting sites. And so we've provided in the past some of that same support for our McVie grantees. So concrete supports seem to be a huge issue right now during this time. So I do agree that that is a good place to put our funds.
And along those lines, will there be any additional support for technology beyond what you've been able to do so far?
We have been able through, I mentioned just the one piece with NFP. We've also been able to use some of the CARES Act funding that the State Health Department received to buy Surface Pros for all of our child guidance clinicians so they can do telehealth services in the community. So that's another way that we've been able to support services in the community through health department. Technology right now, yes, is huge, and we want to support that however we can. And so as those needs, as we become aware of those needs and are able to assist with that, we certainly will.
Okay, I think then with that, we'll continue with the health department presentation. All right, move on. Okay.
Okay. Let me get this situated. Well, good morning, everyone. I am Lachey English, and I am the program grant consultant with the Office of Child Abuse Prevention. We work with Parents as Teachers model and are part of the Family Support and Prevention at the Oklahoma State Department of Health. We believe that family support services, which are deeply embedded in our communities, are part of the future of service deliveries to families to engage the whole community in a way to serve the whole family. So today I am here representing the Family Support and Prevention Service and the work we have been doing to develop the Oklahoma Family Support Network. This morning, I'm going to very briefly walk you through all that we've done so far, I will talk a little bit about the collaborations that are currently happening between OSDH and DHS. And then I'm going to speak a little bit on what's to come. So in doing so, hopefully I can tie all the pieces of the network and the Hope Community Centers and the National Family Support Network's Family Resource Framework together for you and allow you to see how they fit together and how each of them do a different job in the overall picture. Next slide. Can you go to the next slide, please? Okay, so the first thing I would like to do is give you an idea of what a family support and strengthening network is. I've put some general things up here for you on this slide. The National Family Support Network defines a family support and strengthening network as 2 or more family strengthening organizations, which can include family resource centers. So the first thing is it's important to know that it doesn't have to be all family resource centers, but it can also include other organizations that don't completely fit this model or that are just maybe a community-based organization that do not fit it as closely as the other organizations. They also ensure a coordinated quality support for families. They serve as the backbone entity to help leverage and coordinate the collective impact for their members. And then they create opportunities for service providers to meet formally and informally, exchange information, make connections, develop relationships with each other, and build capacity amongst each other to develop joint projects and address systems changes, which is exactly what is being done now with DHS and OSDH in this project. Next slide, please. So some of the common functions that I wanted to point out is that a network can do for its members is to increase connectedness, coordination, cooperation, and collaboration amongst each other. It's really a way to bring everyone from across the state in an organized way together to know what everybody else is doing. Providing technical and training, or providing training and technical assistance, working on advocacy, policy, and legislation, and providing and maintaining a shared data tracking system if needed. Next slide. So this is a timeline of really what we've been doing for a little while. I'm only going to talk about a few things on here, but I wanted to just give you an idea of how long this vision's really been in play for us at OSDH and DHS. We became an official state network within the National Family Support Network in 2018. We quickly established our initial training team of 2 people to deliver the National Family Support Network's standards of quality for family strengthening and supporting. We have used this training as a way to really reach out and engage stakeholders across the state and try and share this concept with them as well as the framework. At the beginning of 2020, we started having discussions between OSDH and DHS about the vision that DHS had for community family resource centers. And we realized very quickly that this was also something we had been thinking about as well, and realized that we could join ranks with them and really have the overall capacity to make this happen. So during the spring of 2020, we began to collaborate with DHS on an RFP. It was released in September, and it will fund 2 family resource centers. And we at OSDH are able to provide the standards training to the Family Resource Centers. And the Family Resource Centers are going to be the inaugural members of the Oklahoma Family Support Network. So this will mean that the development of the network will be able to continue to evolve and grow. And then in August, we first began to hear about Hope Community Centers, and we are really excited to see these centers being implemented. And in a few minutes, I'm going to explain a little bit about how they are similar and different, and how they differ from the Family Resource Center model that I'm referring to through the National Family Support Network, the one that the awardees of the RFP will be implementing. Next slide, please. So I have mentioned the National Family Support Network a few times. I wanted to stop and just take a moment to explain a little bit about this organization. The National Family Support Network is a membership-based organization comprised of state networks of 2 or more family support and strengthening programs, such as Family Resource Centers, and they work together within a collective impact framework to ensure coordinated quality support for families. As the United States coordinating body for family strengthening and support networks, the National Family Support Network currently has 30 members, network members comprised of more than 3,000 family support and strengthening organizations, representing the great geographical and demographic diversity across the nation. And I have on here their mission statement and their vision. The vision is that they see a nation in which every family is thriving and every state has a strong and effective family and support strengthening network. And I think that that is a key to what all of us in Oklahoma see for our state as well. And I was just in a planning meeting last week where someone spoke about a place where families could go to thrive and not survive. And when I heard that, I smiled a little bit, because that is what the vision that the National Family Support Network sees for every state in the country. So I think that this is a great fit for what we envision for our state. Next slide, please. So the National Family Support Network has 2 major frameworks that they utilize to lay out their Family Resource Center framework. So they utilize these 2 longstanding and research-based frameworks to provide Family Resource Network framework that will be utilized by the RFP-funded Hope Centers. The Protective Factors framework is one, and it comes from the Center for the Study of Social Policy. Research has shown that these 5 protective factors that you see there on the slide help to increase family stability, they enhance child development, and they reduce child abuse and neglect. And so we're working, as we're working with families across Oklahoma, we want to support them and build these protective factors, because we know that they help to make a positive difference in these families' lives. And the second framework that is utilized is the Principles of Family Support Practice. These were developed by Family Support America in 1996, and they continue to guide the family support and strengthening field today with their incorporation into the nationally adopted standards of quality for family strengthening and support. Next slide. So I have mentioned the standards training, the standards of quality for family strengthening and support training a couple of times. This is a training that helps to create a common language across different kinds of family strengthening and support programs. It includes family resource centers like community hope centers that we've been hearing about in Oklahoma, as well as home visiting programs and other child development and family support programs that we have in communities throughout every county in Oklahoma. The training focuses on the 5 core areas that you see there on the slide. They are family centeredness, family strengthening, embracing diversity, community building, and then evaluation. And it's designed to be used by all stakeholders as a tool for planning, providing, and assessing quality practice for families. So in Oklahoma and the trainings we have had so far, we have had private funders, we've had public funders, we've had state agencies, family advocates, nonprofit organizations, and faith-based organizations all become certified in the standards. We're really excited about that because when we think about this collaboration piece, those are all the people we want at this table. Okay, next slide, please. So I have mentioned the Hope Community Centers and the collaboration between DHS and OSDH. I want to explain now a little bit more about this. I'm sharing a few images this morning to help you connect the pieces, hopefully. This slide shows the vision of hope that has been used for the development of family resource centers in Oklahoma. The vision is to braid together the National Family Support Network's centers framework and the science of hope, as you see here on the slide. I have already discussed that Family Resource Centers model, and I know that many of us are already familiar with the science of hope from Dr. Chan Hellman's research. And we heard Secretary Brown speak about this and about their collaboration with Dr. Hellman earlier this morning. So next slide, please. So we have been hearing a lot about the CARES funding for Hope Community Centers. And you've heard me refer to Hope Centers as family resource centers, utilizing the National Family Support Network Strengthening Family Framework. I would like to share this one final image that I believe is a great visual to help us see some areas that will or could be focused on from the RFP funded centers versus the CARES Act funding centers. And then finally, you'll see the gold standard Hope Community Centers. So first, the RFP funded centers, these are the Hope Community Centers that are based on the previous slide of the National Family Support Network's Strengthening Families Framework and Hope Science. And then you see the CARES funding centers. These are centers that are also based on Hope Science and include a virtual learning model. The main focus of the CARES funded Hope Centers is school supports, and it's really what sets them apart from the RFP funded centers. When the immediate need of remote education for Oklahoma school children was presented due to the current pandemic, the vision of the Hope Center model was able to be utilized and transformed very quickly to meet this need across the state. We have been so excited to see the collaboration and success thus far from the Hope Community Centers. And again, Secretary Brown told us earlier this morning that as of today, there were 36 centers. There are 36 centers serving approximately 2,000 students across Oklahoma. I can tell you that that number has grown just since last week. They are, the hope is that these centers will be transformed to fully meet the Family Resource Center framework in the future. So this is where you see the gold standard Hope Centers on the slide. And these are the highest of standards that align strictly with the National Family Support Network Strengthening Families Framework, as well as the Science of Hope model, and then even more standards implemented there. So finally, I'm very excited to also mention that there's currently a lot of work going on with many partners throughout the community, both public and private. And the focus of that is the sustainability of a gold standard Hope Center throughout the state. So there's a lot more to come in that area that's currently being worked on. And I just wanted to add that as Anira and Amy went through their data with us this morning, there were a few things that specifically Amy, when she talked about the data from the family's perspective, that kind of caught my attention. And one of that, or some of those, are that almost 30% of families had not heard of some home-based services in their community, and 63% had not heard of any parent support programs, and that quality childcare, they felt was really hard for them to come by or to access, and that services for the child's social, emotional, and or behavioral development was really hard for them to find or access. And so also Anira had spoke to some of these things of the professional's perspective. And I just felt like this was even more information to help guide our vision for what a Hope Center is doing and what it looks like in the network itself. It's telling us that families aren't aware of what's there, and we really need to listen to the families. And so with this model and framework being very embedded in the community, the families are what drive those services. They're telling us what they need, what they want, and we're helping them organize it and see what you already have in place and co-locate the resources that are already available to help with those transportation barriers or whatever we need to do. And so I appreciated that update on that data, and I think that that's going to be really helpful for what we're doing with the family resource centers. Okay, you can go to the next slide. So as I mentioned, this was so brief. There's so much I could talk about. I wanted to leave you with my email address. Please reach out to me if you have any questions. If you're wondering how to get a standards training in your organization for your staff, if you're wondering how to get it to your county, your community, your church, let me know and I can help with that. I can help answer questions or direct you to whoever can answer those for you. Thank you.
Thank you, Lachey. Couple of quick questions, and I think for some clarification. So you have an RFP that you have released right now. Am I correct on that? And you're planning that you'll have 2 family resource centers that will be funded through that RFP? Okay.
Yes.
And then the second part of that is a little bit more about, and I think you addressed it, but maybe talk a little bit more about will there be a pathway for the CARES funded centers to transition into being a family resource center?
Yeah, so they were stood up very quickly for this immediate need. And because of that, it wasn't for every single community partner that is doing this. It wasn't maybe feasible or quite, they weren't ready to meet all the points of the family resource center model. And so for that reason, they are set apart a little bit, but we hope that they would, once this funding is no longer available, we hope that they would do anything they need to do to help transform and meet that that gold standard model.
Right.
It would be up to
Yeah,
them.
this is
go ahead, Dr. Schwab.
Yeah, no, this is Deb. You guys have to call me Deb. This is Deb, and what I would say is I think there's a lot of I know that the Brett, myself, the Seesaw committee, like we're doing a lot of, in a sense, conversation around this and pushing around it. I think, you do things sometimes through because you need to your point of there's a speed element because of the pandemic that we're in. But we definitely want to see a move from the immediate solution to a sort of high quality, ongoing, collaborative solution. I think especially that business of listening, having a parent board or listening to the voices of the people who are served is a huge piece of it. And so I whether every single organization will go that direction or not, I do think that is the future, the sustainable future. And that's definitely what a lot of us are kind of joining with you all on and pushing for. So I would just speak a ton of support for that philosophy and that approach. It is the right approach for the long run, for Oklahoma, in my humble opinion.
Great. Yeah, and I think a lot of us can appreciate the swift need to do something with dollars that are available and families that needed some immediate supports. Love hearing the longer term vision about building in the kinds of quality and supports over time, and it's so exciting. I had a follow-up question. Is there a list somewhere available of where the Hope Centers currently are right now? The ones that were funded as Hope Centers?
Brett, are you on here? Do you want to speak to that?
Hi, everyone. We actually do have a list. They're mainly within Oklahoma City and then the Tulsa area, but we do have a few in southeast, such as Durant, I believe Lawton. So what I can do, Deborah, is get you a list of the operational ones, and it can be sent out so that everybody on this call knows where the community Hope Centers are located right now.
Okay. Thank you.
It'll be changing by next week, though. I mean, so you do have to sort of realize it changes.
It's going really fast. Every day we get more inquiries and getting them up and going. And so, like Lachey mentioned, that we are in Secretary Brown, there's 36, but the majority are Boys and Girls Clubs, YMCA, Urban League here in the city, and then of course St. Luke's. And so I'm sure there's a few that we're missing, but there's a lot of partnership going on within these organizations and many more sites to come. So we're super excited. So Deborah, I'll get that to you.
Okay, perfect. Thank you. Thanks. And thanks for that kind of rundown of snapshot of who's participating right now. Thank you. That was a very informative session. And I think I speak probably for a lot of us. It was really helpful to understand the intersection between the Family Resource Centers and Hope. So that was very helpful. So with that, I don't have any particular burning center questions, I'm sorry, at the moment. So Beth, I'm gonna turn it back over to you. Thank you, OSDH folks, for a great presentation.
Yes, thank you to Lachey and Amy and Anira. And it's my pleasure at this point to introduce Dr. Deborah Shropshire, or Deb, as she refers to herself. Dr. Shropshire serves as the director of the Child Welfare for Oklahoma, Director of Child Welfare for Oklahoma, and is also a pediatrician and professor at Children's Hospital at OU Health Sciences Center. Her advocacy and heart for traumatized children and families has been nationally recognized. She's been a pioneer in the belief that the way to heal child abuse is to prevent it, not just treat it after it occurs. So I turn it over to Dr. Shropshire.
Absolutely. Thank you so much. And just a couple of things, I guess. First of all, if you need to stretch, like we might need a 7th inning stretch here, because I know it's been, we've been sort of an hour and a half, an hour and 40 going into this, and we're fixing to go into the last few minutes, really, hopefully, really kind of hammering home the connection between the work that has been discussed and where the Department of Human Services and specifically child welfare wants to go and wants to be. And so I want you to be able to enjoy that, focus on that. So if you need to stretch, take a break. I'll tell you, as we've gone through the conversations this morning, like every conversation I feel like has built on the one before it. And I'm so energized, kind of as the morning's gone on. Lachey, I could listen to you talk about Family Resource Centers forever. Beth Martin and I were talking about this, 15 months ago, and how could child welfare partner with health department more around this, because we do see some of these kinds of models as a incredible, sustainable solution, necessary solution for Oklahoma families. And I could not be more thrilled with the progress that's been made over this past year and the leadership of health department in that space. And just know we're like cheering and pushing and, you know, saying, hey, we want to be on the train with Family Resource Centers as well. So my name is Deb. I am a pediatrician. Most of you on the call have kind of scanned through to see who was here and saw lots of friends on the call. So many of you I know. But for those of you that don't, I'm a pediatrician at the Health Sciences Center by training. And so I've spent about 2 decades serving in that role. And it's an interesting thing to look back and say, how in the world have past influences shaped me? Director Brown was talking about the, you know, his understanding and acknowledgement that what has happened in the past shapes who we are in the future. And that's true, not just for trauma, it's true for many, many experiences we have. And for me, an experience that shaped me happened when I was in medical school, because prior to that time, my experiences around medicine were really kind of in a more emergency medical space. And my family growing up was one that, you know, you didn't go to the doctor unless you had a bone sticking out. And we were Western Oklahoma people. We just duct taped it and, you know, kind of went on unless you really had to have something serious done. And so the concept of prevention, even in healthcare, to me was just not one I grew up with. And so having that emergency mindset going into medical school, thinking that's where I would be, I ran smack into the issue of child abuse, and not just of child maltreatment, but how great a role poverty and neglect and other sort of interpersonal relationships and behavioral health and substance use plays a role in sometimes what happens with children, but also in the fact that there were these systems working to try to advocate for stronger families, to try to advocate for safe children who also had the opportunity to be well. And I just fell in love with that. And so fast forward a few years, I was in pediatrics, not emergency medicine, but in pediatrics because I just fell in love with the field so much. And then ultimately wound up spending time in a juvenile shelter, a foster care shelter, where I really felt like I was kind of treating the end of the train, like the whole family situation had already happened, and we were kind of inheriting the end result of that, and found that to be very frustrating. And so over the years, I've wound up my own self personally and professionally taking step after step after step toward prevention, toward family strengthening, toward how can we move up the stream instead of pulling the bodies out at the end. How can we move up the stream and actually wind up in a place where all families are strong and healthy in our state? And so it is one of my favorite. This is one of my favorite sort of moments in my adult life right now, is this moment of getting to collaborate together with you all and with the organizations, the agencies that are really, really beginning to gel around a common vision for child and family well-being in our state. That is not to at all take away from the many thousands of Oklahomans who've stepped up to serve as foster parents or adoptive parents. We're going to talk a little bit this morning about our foster care system and what needs we still have, because I'm going to tell you that that system is also prevention into the next generation. How we take care of the kids that we are interacting with right now, that we're responsible for right now, and the families who have stepped into adoption and the creation of new families, how we take care of them is child abuse prevention and family strengthening into the next generation. And so we see both ends of this as something that we are passionate about. And I'm going to share with you a little bit today, kind of where we're going in terms of child welfare, and especially as it relates to the Family First Prevention Services Act. And so anyway, I would just say thank you to the health department for letting us kind of tag on to your meeting. I just feel like these two things fit together really well, and we're honored to be here. If I could have the next slide. So Director Brown mentioned True North, and so he shared some agency True North goals, but I want to share with you our child welfare specific True North goals. And so those goals are 3. So it was an interesting process to go through this with him, because the question he actually asked us when we were writing True North goals back last fall was, if you could only get 2 or 3 things right, if like you could get two or three, maybe four, that's all you could get done. What would Oklahomans say actually served them well? And so not just sort of how would you get your federal partners to think you were doing a good job, or how would you get your lawsuit partners or your community partners, but actually what would the families you're serving say was actually useful? And so we developed these three True North goals, and that is to equip and empower families to provide a safe home for their children. I left that broad on purpose because I wanted to move us upstream. I wanted to figure out how to partner with those folks who are out ahead of a call to the hotline, working on behalf of strengthening families. Our second goal was that if children enter foster care, that we understand and we meet their specific needs. We believe that every child and every family is unique. There are maybe common experiences or common stories, but every child and every family deserves for us to look at them as individuals and to say, what is it that you uniquely need? And when we take that approach, we believe we can construct the kinds of supports around those children, around their families, around their caregivers, their foster families or relatives, or whoever it is that is in that child's life, to actually be able to move that child into a successful future. So we are going to individualize, including their need for safety, connections, family, community, and culture, addressing their health, behavioral health, developmental, and educational needs. And then finally, that we will aggressively pursue the belief that every child and youth deserves a family and the supports that they need to grow and develop into healthy adults. And this really is that piece of not just the present family, but the future when these kids become parents themselves. Next slide. So with those goals, they naturally fall into some strategic priorities for us. And so we are prioritizing our time and our resources and our energy around several areas or with several kind of values in mind. One of those is around prevention. We're going to talk about prevention today. Now, we're also going to talk about what prevention means in sort of child welfare language versus maybe in the language of the health department, and how do we overlap these into a continuum that's about family strengthening and prevention of child abuse. Family-based placements. We have children who are in our custody who need temporary or sometimes permanent families. And the idea of quality individualized family-based placements is one that's very dear to the child welfare system. Non-family-based placements, how we deliver care for those kids who may need something that it has to happen in a different kind of a space than a family, is really important to us. We want those experiences to be a high quality, intentional experience. And that actually is representative of a piece of FFPSA that we're going to talk about as well. We believe wholeheartedly in evidence-based programs. The idea that while we understand there's a lot to still be learned and there's lots of new innovation to do, that we should lean on what has been learned. And that's really the point I think I kind of butted in, but I was kind of trying to make about the resource centers. There has been a great deal of learning that's been done around family resource centers. We want to make sure we capture that and take it forward with us into the future. So even while we may develop solutions for a problem that are innovative solutions or kind of temporary solutions, we always want to be looking to the evidence base to develop those. And we always want to be looking to evaluate so that we are adding to the evidence of what works for kids and families. And then Director Brown mentioned the idea of transparency. And I see resource and financial accountability as a transparency issue. It's also a value alignment issue. In my own checkbook, in my own house, I can tell you what's important to my family, but the truth is, if you look at my checkbook, you would see what I spend my money on, and that would tell you what's actually important. The same thing is true for our agency. We should put our money where our mouth is. And if we're going to say we value strengthening families, how do we spend our dollars to do that? We should be accountable for that. Next slide. So I wanted to just give you a little snapshot of kind of the operations of the Child Welfare Division of the Department of Human Services, just so that you have a little bit of a sense of kind of the scale and the sort of the outcomes that are produced right now. So the abuse and neglect hotline receives somewhere around 80,000 calls a year, with 77,000 calls a couple of years ago. I think Director Brown mentioned 81,000 calls this past year. Obviously, the year we're in the middle of right now is kind of unusual. We had a drop in calls to the child abuse hotline in March and April, once COVID became an issue and kids went home from schools and childcare. That actually has returned to a more near normal volume. So we're not quite at 100% of our past volume, but we're actually really quite close, and especially through June and July. August and September, volumes running around maybe 90% or so of normal, and we expect that really to continue, maybe even to increase a bit over the next couple of months. About what's important to understand about the hotline is this, and this is pertinent to some of the internal conversation, or it's part of the internal conversation we're having right now, I guess, and pertinent to this conversation about prevention. There's a lot of people who call us because they are concerned about families. And we've said for 20 years, 30 years, if you have a concern about child abuse, call the hotline. That's what you're supposed to do. But the reality is many people who call the hotline express some concern about a family, and there's no mechanism in our state for following up on those families. We have statute and policy and things that guide us in when we're taking the information to determine whether we should come step on somebody's front porch. And that ought to be a very serious question. Once I receive a call, our hotline receives a call, we should be very thoughtful about under what conditions and how, and what's the approach to going out and showing up at somebody's house and saying, hey, I want to come in the door and find out, how you're parenting. On the other hand, those calls represent concerns from community members, whether that be family members or neighbors or teachers or police officers, that it seems a shame, it seems like a wasted opportunity to not figure out how to leverage those calls, those concerns that are voiced as a way to figure out how to outreach families. Because for the most part, if some teacher's calling saying, I'm worried this kid doesn't have enough food at home because they come to school hungry every day, well, maybe somebody ought to check and figure out if that family needs food. How could we leverage the interaction that we have as child welfare with the community, as well as with families, to figure out how to move upstream and actually support families so that there's not a second or a third call, or so that the situation the family is in can stabilize before something serious has happened. So those are some of the things that we're thinking about. So this data is pertinent to that, because out of the 77 or 80,000 calls we receive, only about half of those actually make it through to some kind of next step for child welfare. And out of those that we do go out and interact with a family, only about a fourth of those result in a substantiation, meaning that we find child maltreatment. Out of the child maltreatment we find, the vast majority of the time, we put it in the bucket of neglect. And neglect is influenced by lots of things. That's going to include often families who may have substance use issues or mental health issues or resource issues, housing, or those kinds of things that are sometimes driven by poverty. Things like intimate partner violence often results in a situation where children are neglected. The downside of that is our big bucket in the state of Oklahoma is families that are not, it's not the story that's on the news about child welfare or child abuse. It's the families that really you sort of look back 3 or 4 steps and you wonder, had they had a different resource somewhere along the way, would it have made all the difference? And yet, the other side of that, even though it's somewhat discouraging at times to me, is it's also the bucket of opportunity for us. And I think, again, back to the idea of family resource centers and some of these other things that we're talking about across our agencies and across with community partners, there is some solution there to the problem of families running into the child welfare system in the way that we resource families upstream. And I think a tremendous opportunity in our state to impact families in a positive way. So if you take 77 or 80,000 calls to the hotline, half of which are screened out, and then half of which result in a touch somehow by child welfare, and then only 1/4 of those result in a substantiation. If you take that much smaller pool of children and families, it's important for you to understand that over the last really 5, 7, 9 years, child welfare has developed and continues to push on and grow and develop prevention services. Now, when we talk about prevention services or a prevention case, what we're actually talking about is families who have bumped into our system. There's a concern for child abuse. There's been a substantiation or a pretty serious concern. And we're serving those families as a mechanism for trying to prevent something further from happening. And that's an important distinction we're going to talk some more about. But that's what we sort of label as a prevention case. We are actually serving, once a family moves through an investigation, we are serving more than half of the families that we maintain some kind of ongoing case involvement with. We're serving more than half of them through our prevention cases. This reflects a deep commitment on the part of, again, over a several year period of time, the part of child welfare to say, we want to take a real stab at trying to figure out if we can strengthen families without having to remove children into foster care. Obviously, there's going to be circumstances where that removal into foster care is the safe and appropriate step. And it is, so I think of it this way, coming from a medical background, my child welfare people are probably sick and tired of all my medical analogies. But I think the child welfare system, we talk about prevention and permanency or foster care and removal as almost like, if you think about in the healthcare system, if I get a headache, I can take an ibuprofen and stay home. If I get sick enough, maybe I have to go to the doctor and get something stronger, prescription medicine, or depending on what's wrong with me, maybe even the doctor puts home health or some kind of specific intervention actually in my home. Maybe you have to have home physical therapy for certain kinds of things, or a home nurse or things like that. If I get sick enough, if I have enough distress and I'm not able to be managed from a medical perspective at home, then I need a higher level of service, a higher level of intervention, and I may have to step into the hospital setting, or in the most extreme situation, into an ICU setting. But as soon as I'm stabilized, I'm able to move back down. It's that sort of continuum that we are thinking about as we interact with families. What can we do to serve families in a way that doesn't result in them having to be in the hospital that child welfare is, or in the ICU? And on the other hand, there are clearly times when that higher level intervention is needed. So that's just how we're kind of thinking about it. But it's important for you to know half the time we're able to do that not in a foster care case. There are about 7,740 children there's actually 7,740 children as of yesterday in DHS custody. Not all those are in foster homes. Some of those are in trial adoptive homes or trial reunification homes, but about that number in our care. And around a little over 4,000 kids enter and exit each year. So there's a flow of children who are coming into and exiting out of the foster care system. And 43% of those reunify, and 49% of them go to adoption or guardianship. Now, that's an important number to me because the rate of success of our prevention cases is considerably higher than that in terms of keeping you with your parents. If you are a child who moves into a prevention case with us, maybe 88, 90, 92% of the time, you're going to stay with your family, and that case is going to close successfully with you staying with your family. On the other hand, children who enter foster care have a much lower rate of going home. Now, arguably, those may be the more severe situations, the more high risk or challenging situations. But we should be looking very closely at our early decisions at the hotline and as we do our investigations and as we make decisions about which kind and level of intervention children and families need, because it has dramatic difference in terms of the outcomes. So it's important to understand that. And then we also are responsible for children through their childhood. In Oklahoma, we define 18 as kind of the end of our foster care official foster care system. Some youth can actually voluntarily stay in foster care longer than that, but it's uncommon. Many states have extended their foster care system to 21 or even 23 so that they can continue to serve these young people into adulthood. We are looking to continue building supports beyond 18, beyond just what we already have for some of those youth. But we've been also undertaking a pretty heavy effort to work to help young people who are in that sort of 16 and 17 age range to really make a permanent connection, a legal permanent connection with a family, whether that's through adoption or guardianship or even returning home, so that those children don't age out of foster care. So a lot of effort around that. I'm going to show you just a little bit of. Next slide. All of that is pertinent to how are we impacting family strengthening right now, as well as building towards family strengthening in the next generation. So that's all of that is a setup for us to talk about building a system truly of child and family well-being. So I just want to show you a few little quick data kind of slides, and then we're going to talk more about sort of the meat and potatoes of what we are doing right now. I just wanted to show you a little bit again about types of maltreatment. I mentioned the idea that neglect is our biggest category, and you can see that here in the way that we break down our findings. Next slide. Within neglect's kind of a big bucket that includes a lot of other stuff. It includes a bucket called threat of harm, and that's going to be where a lot of different kinds of family factors that may put children at risk, or at least they were concerned about risk for that child, kind of lives. A lot of situations where maybe there's a pretty significant substance use and the concern is the child isn't safe, or those kinds of situations may wind up in that threat of harm bucket. There's also exposure to domestic violence, and then failure to protect, another big bucket. And so I think none of us are totally satisfied with these labels. I'll just say that, because it still feels like there's a little bit of ambiguity there. I'm comfortable with the idea that child welfare it's really, really hard to label, to create the labels that everybody fits in. It is a very family individualized system. It needs to be, but these are the buckets that we have right now. So I wanted you to see how that neglect situation breaks down. So next slide. Just to give you, again, a few reasons why children actually enter foster care. Remember, kids could have a call to the hotline. There could be a substantiation, and that not necessarily result in entry to foster care, because we do serve so many family situations in their home or through a prevention case. But here are some of the reasons why children enter foster care. Again, neglect, we've actually split out in this particular slide parental substance abuse, and then also inadequate housing as a contributor to entering foster care. Now, I got to tell you, and I mean, these things, I'm not saying these things are easy to solve, but it ought to make us stay awake at night if not having housing makes it so that your kids wind up in foster care, right? We should be bothered by that. We should be bothered by parents who are struggling with substance abuse if we're in communities where there's not adequate treatment options. And I know there are in some communities, and the Department of Mental Health has done a fabulous job with some of its regional grants and things like that, building additional supports for families with young children, babies and young children where there's a substance abuse factor. But some of these things, this is not the stuff that's on the news. I mean, the stuff on the news, the terrible story, that's what sometimes people think of when they think about the child welfare system. What we are dealing with and addressing is often issues of behavioral health, relational poverty, resource needs that our community could figure out how to solve. And I think I just love the group of people we have on this call, because I know you guys I'm singing to the choir here. You guys are in the same room I am, but it makes me stay awake at night to think about kids being in foster care, knowing that the reunification rate is 43%, that once kids enter foster care, it's challenging to get them home. When I see a slide like this one, where inadequate housing or those kinds of factors are the cause of entry into foster care. Next slide. So I just want to show you a couple of demographic things. So this is kind of the breakdown of kind of age groups of children who are served in out-of-home care. Not surprising, 0 to 5 is our biggest category, because those are also, our belief would be that those are also the most vulnerable children, both from a physical standpoint, developmental standpoint, and an ability to actually sort of help out with garnering their own resources. I have teenagers. I have two kids myself. They're teenagers and they can cook for themselves. In fact, half the time they're cooking for me, which I'm really thankful for. But when they were 1 or 2 years old, I needed to take on that responsibility. And so those youngest kids are the ones that are the most vulnerable. So it's not surprising they're represented in that way in our system. Next slide. This just gives a little bit of a breakdown from our data system of how we are able to retrieve information about race and ethnicity. We do have sort of this large category of kids who are multiple races, and it starts to get a little bit complicated to try to sort out disparities and things like that in our system. But it is something we're talking about quite a lot right now and trying to figure out how to take a look at our data in a way that helps us identify any areas where we may have disparities. Next slide. This just gives you a sense of the different kinds of places where children may be if they come into our foster care system. By far the most dominant are various kinds of family homes, whether that is with a relative, a kinship relative, or a kinship, what we would call non-relative, which is someone who's known to the child, such as maybe a teacher, neighbor, somebody like that, as well as our incredible Oklahomans who take in kids they don't know. When I was a medical student and I was learning about these systems, I was fascinated. I did not have any context before that. I had not ever really been around Department of Human Services. My dad was a pastor. We were in a little town in Western Oklahoma. And honestly, the community tended to rally around families who were in need. And I didn't know anything about child welfare, DHS, or anything like that, foster parents, or any of that kind of stuff. So when I was learning about it, and I realized there's these people out there who literally raise their hand and say, I'll take extra kids into my home and take care of them, somebody else's kids. I don't actually know what all's been their experience. I don't know what that is going to do to change my family dynamic, but they volunteer to do it. It's absolutely amazing to me. And so I'm deeply grateful to the many Oklahomans who have stepped into fostering or adopting over the years, and just really, really enjoy interacting with them. We have a few children who are in other kinds of settings, whether that's hospitals, or we still have a few children in various kinds of shelters, group homes, et cetera. But by far, the vast majority of our kiddos are either with their extended family or friends, or with other Oklahomans who've stepped in to take kiddos into their home. Next slide. So one of the things that I was thinking about when I was listening to Justin talk earlier, Director Brown talk earlier, was one of the things he said to us that's been very powerful is he talks about in his family how each family member has their own kind of desires and their own goals that they write down. And then they share them with each other because they view, and within their family, they view each other's goals as equally important to their own. And what that means is that for him, if he knows what his kids' goals are, personal goals are, that he feels like it's his responsibility to team up with them to help achieve their goals. And if they know what his goals are, that they are also likewise interested in teaming up with him to achieve his goals. And I was thinking about that this morning as we were thinking about this collaboration, even this meeting where we're for the first time collaborating together, the Office of Child Abuse Prevention, and thinking about the state child abuse prevention plan, really trying to knit that together with child welfare and our work in Family First and other kinds of efforts to kind of move upstream from tertiary prevention, where we kind of are, how we knit that together. And the idea that if we know each other's goals, that couldn't we take the same approach of your goals are my goals? Like Beth Martin, that's how I feel about you. Like whatever your goals are, they're now my goals. And so that my job is to figure out how to leverage time, resources, whatever I can influence to help you achieve what you need to achieve. And my ask for you all is that you would do the same for me, but then you have to know what our goals are. So I want to unpack just a little bit, kind of where our child welfare system is and what some of our needs are and some of our goals are, in the hope that what I'll find from you all is sort of collaboration and partnership around helping us get our goals met, as we even try to do that with you as well. Because I think if we're all pulling in the same direction of family and child well-being, then the faster we can each get those goals accomplished, the better it is for our whole system. So you all, most of you, if not all of you, may know that we are under a lawsuit that was settled in 2012, is when we started on the effort to really reshape child welfare as it relates to the lawsuit. There's a couple of things I want to unpack about that, though, and then I want to overlay what we're doing related to the lawsuit with what the future is related to Family First, and how all of this kind of interfaces together, so you'll kind of understand it. The Pinnacle Plan is our child welfare system improvement plan. And the Pinnacle Plan, it's important to understand the lawsuit was about the experience of foster care. The lawsuit was not about keeping children out of foster care. You have too many children in foster care or any of that kind of stuff. The lawsuit was about the experience of foster care. When children enter your system, how do you take care of them? Are they safe? Do you have adequate numbers of placements? Do those people who are taking care of those children understand how to take care of them, how to meet their needs? Are they stable? Do they move to their permanent family, whether that's home or to adoption, in a timely way? Those were the principles of the lawsuit. And so over the last 8 years, what's happened is we've done a tremendous amount of work to change and improve and bring more quality to the experience of foster care. And I think that's important, but you also have to sort of understand we are constantly reckoning with the past and the current sort of stresses around trying to improve foster care. At the same time, I'm trying to eliminate the need for it. Now, I'm probably not, I mean, I might be a little crazy. I'm probably not totally crazy enough to sort of 100% believe that we will never need that sort of hospital level intervention I was talking about. But I believe with all my heart that we would need a lot less of it if we could figure out how to serve families upstream. And yet the day-to-day pressures on me and on our system is how to make foster care better. So I just want you to understand the tension of that, because it plays out as we're trying to figure out where to put our focus and our money and those kinds of things. Next slide. So just a few quick little data slides about our system. This shows you a little bit of information about the number of children in the child welfare system. What I will tell you is, if you looked at just about any state, you'll see these things go kind of up and down over time. A lot of that is driven by, could be driven by lots of things. Sometimes it's driven by whatever's in the news. Sometimes it's driven by whoever's fussing about something. Sometimes it's driven by really intentional work programs, evidence-based practice, et cetera. And I will tell you, this last 6 or 8 years, the work has been driven very much around a lot of people being very strategic about how do we make our system better and how do we help families both be stronger so they don't enter foster care, and how do we make sure that children are not staying in foster care for a long time. If I showed you a similar graph of the number of children we've moved to adoption in a timely fashion, what you would see is it looks very similar. We've done a tremendous amount of work in both supporting families upstream and building and strengthening families after the experience of foster care has happened, so that kids are not sitting and lingering in the child welfare system. Next slide. So just a few things. I mentioned some of the principles that the Pinnacle Plan was about. One of those was reducing the need for children to be in congregate settings, including everything from shelters to our group home settings, hospitals, those kinds of things. And this is just a little example of where we used to be, even only 6 years ago, in terms of number of shelter nights compared to where we are today. We haven't completely eliminated the need for shelter care, but definitely have reduced it, have deeply appreciate our youth and family services partners who continue to help us with solutions around both kind of emergency care, but also those children who are in shelter care, because we are missing some pieces of our system, which I'm going to talk about. Next slide. This is just a quick slide to show you a little bit more about adoption. I mentioned the idea that we don't want kids to linger in our foster care system. So when kids who are in care, the situation has been such that the court has moved forward with terminating the rights of the parents, and those children now need to move to their permanent family or be in their permanent family. Many of them are already there as a foster family. We don't want to be in the way of that, and it take 100 years to get the paperwork done, for Pete's sake. So there's been a tremendous amount of work on building those permanent families and ensuring that those families can get on down the road with their lives. And so this slide really represents the timeliness in terms of moving those children who are legally free toward adoption. Next slide. And then I mentioned earlier, the number of children we have aging out of foster care is about half, by the way, of what it was 5 years ago. In the 150 to 160 range. It used to be in the mid 350s. So we've done a lot of work around trying to help some of our older teens move toward a permanent family prior to aging out of the foster care system. Next slide. So all that is context for what we've been doing for the last 6 or 8 years. What I want to talk to you about for just a minute is what we're doing right now, and then dovetail that up against Family First and kind of what the future is for the child welfare system, assuming that we can continue to knock out some of these goals. And with your help, I know that we can. We have had a variety of different kind of placement and service options for kids. But really, when you sort of draw that up, what we've seen across our system is some holes. What that means is we have been able to serve the masses in foster care. So 6 years ago, we undertook a tremendous amount of work to just add to the number of foster homes that we had, and have had incredible, both through community partners and internally, incredible success at recruiting Oklahomans into the foster care space and increasing the number of foster homes. We've done a lot of work also around working with kinship foster homes and increasing the number of kin who are serving as foster homes. But that serves the masses, but it doesn't necessarily serve the one kid who's got this medical condition, or who has this developmental condition, or has this behavioral health need, or some combination of the three. And so we've known that there's a group of kids within our system that we just haven't quite been able to really individualize and build what they need. And so we have undertaken over the past year or so the idea of saying, we have a system that's got some boxes, but if you don't fit in the box, then you sort of can fall through. And so we want to actually build a continuum of care. We actually want to build a system that again, kids can kind of move along or through, and they get their needs met, and there's not any gaps in it. It's not Swiss cheese. It's actually complete continuum. And so that requires not only work we do, but it requires a ton of work with partners to build service options, placement options, et cetera. We also needed to understand what our kids needed. And so we've done a needs analysis that we completed the first run of back last winter. We've now subsequently updated it to say, who are the kids in our system that aren't stable? They're moving around, or they're in a shelter and we were having a hard time finding the right match for them to move out, or we just feel like we don't quite have it right yet. We don't quite have the right thing built for them yet. And that needs analysis has pointed out to us the need for additional foster homes that can care for kids with behavioral health needs, additional foster homes and supports for those families, for children that have developmental needs, the opportunity for some specialized group home care. So group home care that is for those kids who maybe for a period of time need a certain kind of programming or a certain kind of 24-hour awake care, or those kinds of things, or kind of kids that have significantly higher levels of needs. Can we build the right programming to help those kiddos develop the skills that are needed, in a sense, to be able to move toward a family or a less restrictive kind of setting? So those are the kinds of things that we have been really working on, and we really need a significant amount of help from many of you on this call, and from many other organizations, to really get there, because this is the hard sort of ditch digging work that's literally one child at a time, understanding one child and building what is needed around them. And it doesn't fit easily into kind of these big boxes of here's a program or whatever. It really does take a lot of individualization. Next slide. Here's a pretty complicated little map of our continuum of care building that we're doing, but I think it's really important for you to understand, like, this. First of all, it is complicated, but second of all, we actually are building a methodology for how to really look at our system, how to understand the data that we have about what kids need. And then in that middle section, what you see is some of this that we're building at the present time around therapeutic foster care, enhanced foster care, building supports around family members who have kiddos in their home that have behavioral health needs or developmental needs, and then other kinds of specialized homes. The reason I throw this in here, and the reason I'm making such a big deal about continuum of care, is for a couple of reasons. Okay, one is it is one of the goals if we had 2 or 3 things we have to get right as a child welfare system right now, this is one of them. I got 7,700 kids that I'm responsible for. I go to sleep at night every single night feeling the responsibility for those kids. And the group of kids that are not stable. In fact, I take phone calls almost every single night from my deputy directors calling because of some concern they have, some need that a child has that we have not quite been able to figure out how to meet. That is a burden on me and on our system that we will always keep our attention occupied, if that makes sense. The further down the road we can get on building a solid continuum of care, the more attention and resources we will have to move toward family strengthening and prevention. That's the first point. That's why I'm saying, here's my goals, and I need some of you to say, those are going to be my goals too, and how can you help me? The second piece of that, though, is that the same approach to building a strong continuum across all of the sort of out-of-home care space, the foster care space, I believe is what approach we need to take together on the prevention side. Families need a continuum of family care. And maybe some elements of that for some families includes something that's happening in foster care. But we as a state need a continuum that really says from beginning primary prevention all the way through the whole thing. Here's a continuum, and it's solid and it's knitted together. And we may all have to deal with all the funding and all that kind of stuff, but the family just has to be an Oklahoma family and step in. And they can actually be served and be strengthened throughout this. Next slide. So let's talk just for a minute about Family First. So most of you probably have heard about the Family First Prevention Services Act. One thing that's important to know about that language is that prevention in this case is really about the way child welfare thinks about prevention, which means it's families that are up really close to the child welfare system. Beth and I've talked a lot about how do we make sure that people understand when the two agencies are talking that we have maybe different sort of pieces of the prevention system that we're talking about, making sure that's clear. That's also why we are using a lot of language around family strengthening instead of talking about prevention so much. I actually don't think families want us to show up at their house and say, we're here to prevent you from entering foster care, or we're here to prevent you from abusing your child. I think they actually just want us to show up and say, what do you need and how can we help you? So I don't like that word prevention, but that's what it means in this context. So the act was really, I mean, we think it's a landmark bill. I'll say that. I would say it is a landmark bill. We don't know how it's going to play out yet. So in 10 years, some smart person's going to write about how this thing changed child welfare or how it didn't. But there are some really important principles in the act that we're trying to latch onto and run with. Well, one thing about it is the idea that maybe there's too many kids in foster care. Now, I don't know what the right number of kids in foster care is, but what I would tell you again, back to that slide I showed you before, was I don't know that you should be in foster care because you don't have a place to sleep tonight. I feel like we should just find you a place to sleep tonight. And I think this act is saying to child welfare systems, we want you to really think about under what conditions foster care is the intervention, and under what conditions maybe we could come up with some other interventions. Also, the act really is saying, hey, if kids do need to enter foster care, how can we elevate the availability and the quality of both the services on the foster care side, kinship care, et cetera, as well as how can we bring evidence base to the prevention side, so that child welfare system, if you're going to try to help families without foster care or before foster care is the hospital, and you think you could do some stuff with home health to continue the medical analogy, how would we do that? And so really the act does push states in the direction of using evidence base to build quality prevention services to try to help families before foster care is needed, and then once foster care is needed, to strengthen that system as well. Next slide. So this is also, again, some language around improving the quality of foster care. A piece of that is aimed at foster care standards. Another piece of that is aimed at ensuring that if kids need to be in congregate care and group care, that it's intentional, that it's high quality, and that it is ideally time limited, that it is a transitional space for children who need to gain some kind of treatment or skill set so that they can then move into a family setting successfully. Next slide. So I think it's important, again, because of this language of prevention, which is a little bit confusing, to understand what Family First is and what it isn't. First of all, what it is, it absolutely provides an opportunity for child welfare, for us to leverage certain kinds of federal funds that have typically in the past been used to pay for foster care. We can leverage some of that funding and start to move it more towards the front end, towards our prevention cases, and really try to build services that will actually help families without entry to foster care being necessary. And so it does provide an opportunity to finance specific services for children who are at imminent risk of placement in foster care, as well as some special high-risk populations, such as pregnant or parenting youth, children who are at risk of experiencing disrupted adoptions or guardianships. And then we actually, as a state, get to do some defining of populations that we think kind of fit into those big categories, and potentially move some of our funding for our child welfare system in the direction of prevention. It is also a financing opportunity to support child welfare in preventing those kids from entering foster care, supporting those families, and it can be leveraged to build and enhance broader prevention strategies. I'm very interested in trying to figure out how we can leverage this piece up against other organizations who have other pieces of the prevention continuum to build a seamless system that families are just served wherever they kind of land in that system. What it is not a broad child abuse prevention reform effort. There are other funding streams for other elements of family strengthening. So it is really important that as agencies, we work together to try to figure out how to braid those. It is not a financing stream really for primary prevention. That's probably actually one of the biggest sometimes things that I have to sort of talk about is we really are over here up next to the foster care system more so than in the primary prevention space. But again, if we partner well together with organizations that are in that space, then we will create a seamless system. Next slide. I told you that we get a little bit of flexibility in defining who is, in a sense, eligible for 4E prevention services. We partner with the Children's Bureau on ensuring that kind of our definition matches what's within the statute. But we can define a candidate for foster care, which is kind of the eligibility determination in a lot of different ways. And that's something that we're actually kind of working on quite a lot as we speak. Next slide. There's certain kind of services that are defined within FFPSA as the kinds of services that we could bring to the case to assist families with. And these services have to have evidence behind them, but specifically substance abuse prevention and treatment services, both for children and for parents, mental health services for children and parents, and then intensive parent skill building programs that help build parenting skills, parent education, and then individual and family counseling. Next slide. There is, as I've mentioned several times, the need for those programs to be evidence-based. And in fact, through FFPSA, there's actually quite a bit of work that goes into how we define which programs might be eligible for that funding, or how we're going to utilize funding to support programs in Oklahoma, and then how we sort of braid all that together to result in the highest quality, highest evidence-based programming that we can provide to Oklahoma citizens. Next slide. There is a clearinghouse or a website that you can go to that does where the kind of evidence base for a variety of different kinds of programming that fits in those categories is identified. What are evidence-based programs? At what level that evidence exists? And if you were to go there and look at the list of programs, what you would see that's very interesting is many of those programs could be paid for through Family First potentially, but they also are paid for in other mechanisms, other ways, such as Medicaid or things like that. So it is really, again, important that we work together closely with our Medicaid agency and our health department to ensure that we are braiding together funding opportunities in a way that's not duplicative, but actually creates a pretty seamless network for families. Next slide. Of course, we want to leverage. We want to leverage each of our systems in a sense to gather as many federal dollars as we can for our state and for our families. And so we're taking what we're each given in our budgets for state dollars, trying to match them up with what we can access for in federal dollars around some of these strategies. And then the closer we can get to saying, okay, I think I can do this piece. If you'll do that piece, the better we do that, the better sort of the tapestry is for our families. So just a couple of quick little things, and then I don't know if there's going to be any questions or not, but I love this slide, this idea of, again, back to the child and family well-being system of care. The idea that there's a need for things that we do for all families. All families need help. I love the Strengthening Families framework. I talk to my staff all about it all the time, because I think what Strengthening Families says is we all need these things to be strong families. The question becomes, which of the things do you have and which of the things do you not have, and how can I help you fill in the gaps that you have? But every single one of us needs a number of things to really be a strong family. And so there's a need for universal services and universal approaches to all families. But then there's also a need for systems that help those families that are in sort of really high risk situations, or they're in situations where something hasn't gone so well, and we want to actually help a family become stronger so that the future looks different maybe than the present or even the past has. And so the need for secondary and tertiary systems that are strong and minded towards prevention and minded toward family strengthening, instead of having a mindset that says, if you get to this point, it's too late, and now you're sort of done for, you can't be strong again. We have to be thinking upstream all the time in our systems to really have a successful family strengthening, really a family strengthening culture in our state. Next slide. I think I'm just a fan of redemption, like as a philosophy, right? Like the idea that, I've even seen in situations where kids went to adoption and it felt like the whole, thing was a mess. I have seen sometimes a year, 5 years, 10 years down the road, where adoptive families and kids and their birth families all together in one extended family. And you just see those kids thrive. And you see, when I have a great foster parent that really pours into a biological family that's kind of, maybe they're kind of struggling and they don't know how to do this thing, and you can see the relationship develop between those two, and the relational poverty begin to be overcome, and the learning how to do parenting and learning how to do some of the things that some of us fortunately had people around to help teach us, because we all needed to learn how to be parents and how to do this thing called adulting. I've just seen some of the most amazing turnarounds, and sometimes it matches the legal outcome that I hope for, and sometimes it doesn't. But I'm just going to tell you, I think if we together are believers in always, even on the bad days, in the possibility of redemption, and we build our systems to try to figure out how to do that, we have no idea what Oklahoma families could actually look like and how strong they could be. So it's the point of view and the approach that we are taking with child welfare. Just one or two quick little things, because I know we're at the end of our time, but I love this slide because it does show the various kinds of financing streams that support prevention for children and families. This is what I'm talking about when I say we have to work together and braid different kinds of funding to be able to create a true, strong family strengthening system. Next slide. Okay, wow, okay, we made it. It was a fast run. But I thank you guys so much for indulging me to get on my soapbox a little bit, not just to share information with you, but to share my heart a little bit with you, and to say to you, I think, it's back to the question about true north. And I said, if we could just get a few things right, what would they be? And I have to tell you right now, today, if there's a couple things we could really get right in child welfare, we have to get right this: how do we take care of the kids who are in our care, and how do we do it well? And simultaneously, we got to figure out how do we take care of those families that we're running into before the trains kind of hit the wall. And that's where Family First work solidly is, both on that congregate side and the strengthening foster care side, as well as upstream in how do we build quality services for those families that we are encountering. And so That's the direction we're going, and we're just grateful to be in partnership with the health department and others around this. So I'll stop there. Thank you, guys.
Thank you, Dr. Deb Shropshire. We always, I'm always inspired when I listen to you, and am so excited about, some common themes that I heard that we're all saying these days are the family well-being system, that we align our goals and we have a continuum of care. And I think that's something that we all recognize as super important. Because we are at time, I'm going to ask you all if you would, we'll leave the line open for a little bit. If you'll type your questions in, we will be sure to post responses. We've had a few questions and comments. We've had some great suggestions. We'll capture all of that and share back with the group later on. Just a couple of things about next steps. There will be another opportunity for us to come together and talk about the state plan for the prevention of child abuse and neglect. And if you'll save the dates on your calendar for Friday, April 2nd and 2021, and Thursday, October 14th of 2021. Those will be, we want to start some biannual reviews where we're thinking about the plan, looking at the feedback that we get, and really use this as a continuous cycle of conversation so that we can ensure that our plan meets the needs of families in our state. Thank you everybody for your comments. Thank you to all of our presenters. You did an amazing job today, and we will see everybody on Friday, April 2nd. Format to be determined depending on what April brings. Everybody have a great day. And again, we'll keep the line open a little bit if you want to type in some questions. Thank you again, everybody.